I'm in, oh, so I'm in Brisbane, which is Turrbal, Yuggera and Jaggera people. And I'd like to pay respects to elders past, present and emerging. Does anybody else want to acknowledge any of the custodians of anywhere outside of the Brisbane region? Cool, okay, thank you. All right, let's get started. Thanks for joining us. It's the usual Q&A around COVID. So I am coming to you from day 5 of my own isolation because I was in one of the close contact areas. So I've been home alone with a cat and a dog for a few days. So it's been good. I've actually been able to get some work done and get sorted with things. So it's nice to see so many people in the living room with me this evening. I'm just going to go through you will have all seen the email around the COVID update, and I'm just going to go through that again in terms of what we've implemented, why we've implemented it, and offer people the chance to chat or discuss, ask any questions or have any clarifications. So same process as usual. If you've got a question, you can either put up your hand on the little box thing that you do, the reactions, I think it's at the bottom part of your screen, or shove something in chat and we'll answer it as we're going. What I've learned from these Q&As is that the source of most of the information and answers to questions actually come from you as employees rather than me. You've brought to us some incredible resources over the course of the time that we've implemented the Q&As. So please keep doing that. Please keep sharing with each other. Please keep supporting each other through this process. So unless there's any initial questions, I'll just carry on with the information. Is that okay for everybody? If you just give me a bit of a wave, if that's cool. Awesome, thank you. Okay, so from yesterday at 6 o'clock, we went through the process of cancelling all non-essential shifts. And that's just to protect yourselves and clients from any unnecessary exposure during this particular period. How we categorise essential and non-essential shifts. If a shift, when delivered, prevents the risk of harm to a client or to others, either through abuse, neglect, or deterioration of mental health, we call it an essential shift. So that doesn't mean just taking people out to get groceries or health appointments. So we would include essential shifts as going into somebody's accommodation and working with them to make sure that they're healthy and well, or there's recognition of any triggers or warning signs about somebody's mental health deteriorating. So we did that last time in the last snap lockdown, I think that was in April, and we didn't really cancel too many shifts. And I think, again, there are some shifts that are cancelled either through them being non-essential, or some clients have cancelled themselves. And we're just keeping an eye on that, but we will cancel non-essential shifts until Monday, the 5th of July. Everything else that we're talking about in terms of changes is also going to be up until Monday, the 5th of July. And I want to explain my rationale for that. And at the end of the Q&A, I'm happy to take any feedback on the decision making around this. So as it stands at the moment, all of the lockdown restrictions are 6 p.m. on a Friday. And if lockdown is going to be lifted, we're not likely to hear about that until lunchtime Friday. What I don't want to do is only implement changes until Friday and then have to work through Friday afternoon, evening and Saturday morning if there's another lockdown. We had a couple of people on Sunday working through Sunday when the sites were released. So it was round about 3:30, 4 o'clock when all of the contact tracing got released, and rostering team, management team, marketing, everybody jumped on board and did quite a bit of work on Sunday to try and minimise risk. And I don't want the team to have to go through that on Friday evening as well. So that's part of the reason, is just to make sure we've got some smooth and seamless processes across the weekend. And to make sure that we're not putting too much pressure on the service delivery team to then respond to another lockdown. If we can, it takes quite a considerable amount of back-end work to manage lockdown and to cancel shifts. So I want to make sure the team are not too heavily impacted. And again, the other reason is I want to make sure that clients have got some smooth and seamless clarity around what's happening, and I felt that it was better to do that on Monday. So I do recognise that means that there's a small portion of people who will lose some shifts at the moment on Saturday and Sunday. But in speaking to Glenn, there are multiple shifts that require filling over the next week or so anyway. So there is no shortage of work going around. We just might need to be a little bit flexible in what hours we can do. But I'll touch on that. I'll get Glenn to talk for 5 minutes or so at the end of this around rostering and what they might need from you. So that's the non-essential shifts. Does anybody have any questions about non-essential shifts before we move on to masks and other fun subjects? I'll just give you 30 seconds or so to shove something in chat if you need to. Cool, no, okay. Liz, you do. Are you happy to speak out loud, or do you want to put it in chat?
No, speaking is fine. I have a shift on Brevity on Sunday, which is 1 hour.
Okay.
So is that, do I do just that 1 hour shift? Or I know that our minimum is normally 3 hours.
Yeah, well, there's a bunch of different rules around that, Liz. If we can take that one offline, and can you double check with your line manager? So either I'd maybe check with Kelly or Glenn what that is. Yep. And it certainly doesn't mean that that will be your only shift, but there'll be, we're still working through covering what we can. So there will be some areas we need to advise, but if you can take that one to Kelly in the first instance, Liz, and then Glenn if you can't get hers.
Sorry, is that for the Sunday?
Yes.
Yeah, there's another shift on there. I'm just fixing the funding up now, so you'll be able to see it in about 3 seconds.
Cool. Thanks, Izzy. So we won't, thank you for that, and thanks for raising it. What I would say is anything around small issues, not that they're small, but anything around individual issues around your own rosters, we'll take that offline, and you can go to whoever your CCC is, or the CCL, or Kerry, who's kind of helping out across all of sites with Laura being on leave, or go to Glenn if you're not sure about, because there'll be some anomalies that you'll need to have a look at. Madison's put not sure if it helps, obviously hearsay. We may be prepped for a fortnight-long lockdown. I probably wouldn't go into any worries about that too much at the moment. What I can say is that the increasing it over the weekend allows us to better prepare for a longer lockdown. And we do have protocols in place for those. So if it does go into a 2-week, we'll certainly manage that, but I don't want to make any assumptions at the moment. I'm normally a betting person for those things, and the head office team will tell you, and I can see Karen grimacing, I am always right. And I'm not willing to bet on a 2-week lockdown at the moment, but I think we should be prepared that this is going to be a bit more challenging than the last circumstance. So, Madison, it was a direct message, so you didn't panic anyone, and I've shared it. Thanks, Madison. Oh, good. So that was just a direct one around 2-week lockdown. That's okay. I think we're okay to be open and upfront with each other around that. But I'll read those chats more appropriately in future. So noted for me. Thank you. All right, if we move on to face masks. So face masks will be required when you're on shift until further notice. So that does extend beyond the Monday at 12 o'clock, and it does at the moment extend beyond the 2-week guidelines that Queensland Government have put in place. That doesn't mean we won't remove it at the same time, but to avoid any confusion or worries about dates or times, or having multiple dates change and people being confused about that, the masks will be until further notice. So that is when you're working with clients. So that includes supported independent living, short-term accommodation, and community access. And the only time you're permitted to remove your masks whilst you're on shift is if you're doing sleepover and you're in the bedroom and not engaging with clients. You're welcome to take it off at that point. Now, again, I do want to reiterate, I know that it's a pain in the backside. I know it's not pleasant. It's very uncomfortable for people, but my priority is your well-being and clients' well-being, and minimising any risk of contagious and infectious behaviour. So it's the sole purpose that we're doing it. Now, we have had questions around whether or not people are exempt from a medical perspective. If you are exempt from wearing a mask for medical reasons, you will be required to give us a medical certificate to evidence that. Now, if anybody who's had a medical certificate before, that doesn't mean that your personal circumstances will be put on that medical certificate, but we will require confirmation that you're not able to do that. We will then make a determination about whether or not it's safe and appropriate for you to be on particular shifts. But if we do that, we'll work that out individually with you. And that really is just about your protection and for the protection of others. We are concerned about high risk areas like short-term accommodation. So multiple people in, multiple members of staff in, the risk attached to that is quite considerable. So we want to make sure we're keeping it as safe as possible. So if there are any areas of concern around masks, please contact your line manager directly. But it is likely that I'll have to make the decision around whether or not you'll be able to stay on shift. But again, for those of you who've worked with me before, I hope that you would consider me to be fair and reasonable in that space. So any questions about face masks? I'll just check there's one new message. If clients have issues with wearing face masks, thanks for that question, and we covered that last time at our Q&A. It's a legal requirement, so it's unfortunately something that we need to do, and I would use your best skills and engagement with clients to explain that that's the case. I think if there's an issue with clients who, for mental health reasons or for other reasons, can't have employees wearing face masks, we need to make a decision about whether or not it's appropriate or safe to provide them services. So if clients do have an issue that's stopping them from engaging in services, let your line manager know, and we'll make a risk-based decision on that. If it's about just discomfort, then I think use your best skills to discuss that with them. We do have a question around, are you allowed to use reusable ones? Absolutely, no problem at all. Glenn will talk to you. Glenn, I'll get you to talk about the 4-hour thing and the shifts around STA just in a minute, if that's okay. And I think, yeah, I've just had a message about that. Glenn will talk about STA and face masks in a minute, but yes, you can wear your own reusable, but they need to be washed on a daily basis. So we trust you to do that. You're all adults and capable of looking after yourselves in that space. From a cost perspective, we have ordered another 25 boxes of face masks. They're due to get delivered. My understanding is there's still disposable face masks in each house. If you can't get access to them, you're welcome to purchase your own and get a receipt, and we'll refund you. There was a question last time about if we choose to purchase reusable ones, will you refund us for that? To a reasonable degree, yes. So if you want to buy a pack of 3 reusable ones, because that's more appropriate for you, it's more comfortable for you, and it allows you to swap in between shifts, we're comfortable to do that. If it's any more than $20, can you give us a phone and we'll just manage it, as in we don't want you spending a couple of $100s on Diamante encrusted face masks with all of those kind of things in it, partly because it's just not fashionable these days, but we'll be reasonable about what we do with that. Glenn, can I ask you to step in and now and talk just about the STA guidelines around length of time with masks, how many we might need on shift and what people's expectations are, please?
No worries. So with your standard 3-ply face masks, the normal ones that you get from the pharmacy or whatever, the standard average, like the usable time for those is 3 to 4 hours for most brands. So if you're on a standard shift, you will need to make sure you are changing your mask about midway through your shift. So you will need 2 to 3 masks during your shift. If the mask is to get wet, it is no longer, it doesn't work anymore. So you will need to change it if the mask does get wet, if it does get stained. So if you remove your mask to eat, it's probably a good time to put a new mask on. So while you are at the SDAs or any of the still houses, you should estimate about 3 mask changes during your shift. Yeah, and same with if you are working with clients in the community, because each of your shift goes for about 3 hours, 3 to 4 hours. It should be fresh mask as you get out of the car. Take it off when you finish with the client. Take a spare with you in case it does get wet or you have to take it off during your shift. And then at the end of the shift, dispose of it, and then you'll need a fresh one for your next client. So you're still averaging about 2, 3, 4 masks a day for the disposable ones. The cloth one, the reusable ones, I'm not sure on that. I've never done the math into those ones, but the standard disposable masks, you go through quite a lot if you use them correctly.
Thank you, Glenn. I really appreciate that.
That's right.
For the avoidance of doubt, if anybody can hear in the background, nobody is making an omelette. My dog is pattering about. So you're going to hear his tapping in a bit. And I might need to duck out and just give him a small snack, otherwise he'll bark the whole way through this meeting. But I'll try and I'll see how I go. Okay, so let's do travel in the car with clients. So ideally, if we can avoid traveling with clients in the car, that would be fantastic. But we do appreciate that there will be some essential services and supports that are required to happen, including groceries or medical appointments or other scenarios such as this. So if you can avoid car, that's great. We're suggesting to clients that they avoid public transport as much as possible, but appreciate that might then mean that we need to take somebody in the car. If they're in the car, they will be required to sit in the back passenger seat with a mask on. This is a non-negotiable. If any of the clients can't wear a mask in the car, we need to know immediately, and we'll work out the appropriateness of the shifts and how we can problem solve that. But that clients wearing masks whilst in the car is a non-negotiable unless we've decided as a one-on-one. So we will take that on a case-by-case basis, but that's about your protection in an enclosed space. And that's the recommendations if somebody's been at a COVID close case situation and they have to travel by transport, that they can't drive themselves, is that they sit in the passenger seat in the back with the window down, breathing out the window. So that's the recommendations. Does anybody have any questions about the car scenario? Cool. Okay, thank you. Visitors to short-term accommodation supported independent living. Now, the Queensland government haven't implemented this, but just for the benefit of your safety, we're saying no to visitors to short-term accommodation and SIL where possible. Now, we recognise that some people will need visitors for medical or health reasons, and we do appreciate that there may be some circumstances where they'll need visitors for mental health reasons. Those are obviously acceptable, but visitors must wear a mask when entering the premises and for the duration of their visit, unless it's in the bedroom of the client and they don't leave that particular area. So that's something we've put in place. We've done a couple of times now. It's not really presented with any issues, and I'm hoping that that will just continue. Again, it's not government requirements at the moment, but we're doing it just as a bit of a preventative measure for your safety. Does anybody have any questions about that one? So that's no visitors to supported independent living or short-term accommodation, apart from essential visits, and essential visits must wear masks.
Irene, can I just
Yep.
Also they need to sign in and sign out at the in the book.
Cool, thanks, Kerry. Yeah, sorry about that. That's a requirement. Now, Pooji has got we've got the QR codes all set up. I think there's one area that hasn't been set up yet. I think it's Toowoomba, but I'm not sure. And that will be done tomorrow. So we will have the option of people scanning in through QR codes. So we'll be requiring that as soon as that's implemented, and you'll get an email out about that tomorrow. So head office, Ipswich, any of the SILs and supported accommodations, there'll be those QR codes that you get in restaurants and venues. So people will be required to sign in through that as soon as they're fully up and running, but you'll get an email about that. Cool. Toowoomba has been done. Cool. Leanne, do you know which area hasn't, just so that they're aware? Oh, so it's only Sill at the moment that hasn't got them implemented. Cool, perfect, thank you. So it's just the supported independent living that we haven't got that implemented yet, and we'll be working with the clients living there to work through that tomorrow. Okay, some other things to be tidy about is when you're out with clients, we recommend not going to big shopping centres or anywhere where there's multiple people. I think even with all of the situations that happened on the weekend and people being more preventative, we saw that Carndale, was it Carndale or Chermside? Chermside. I get confused about them both because they both start with C, and I've clearly not been in Brisbane long enough to know the difference. So Chermside shopping centre, there was an active case, and obviously we want to try and make sure that we're limiting your exposure to sites where we can. So if possible, if you can try and talk to clients about more local places to shop and get their needs met there. But obviously if you do have to go in, but make sure you wear a mask. I'm making an assumption because of the lockdown that all the food courts are closed, but I do not support and will not expect anybody to be sitting with a client in a food court eating lunch for the foreseeable future. So even if that's what client wants to do, I don't consider, even if lockdown lifts, I don't consider sitting in a food court at a big shopping centre as essential shifts at the moment. So again, please use your common sense with that and how you discuss that with clients. And again, it's about everybody's safety, but want to avoid those busy areas that we can't guarantee hygiene where possible. Any questions about that, in particular around shifts or what to do with people on shifts? Just give you a couple of seconds. Nothing from there. Cool, thank you. And I think the other thing that's on my list is, I know that this is the first time we've gone into lockdown when we have our newly implemented rostering team. Laura Grant's on leave this week. We do have a vacancy in a regional manager in Ipswich. Kerry's just come back from leave and jumping in to support everything from that space. We do have all hands on deck in terms of making sure that the right support's there, but I am fairly confident, and Glenn, you can challenge me if I'm wrong on this, but I'm fairly confident at some point in the space of changing these things that we're going to make a couple of mistakes and we're going to look at things and go, oh, we could have done that differently. If you do let us know about mistakes or you're concerned about something, please do let us know, but please let us know politely, and just keep in mind that the rostering team are doing their absolute level best with the information that they've got to make sure clients are appropriately supported. I spoke to Glenn a couple of times on Sunday evening, and he was hard at work making sure he went through the list on brevity around people who may have been at Indooroopilly and did a lot of back end stuff on Sunday evening that he didn't have to do. And I think that's been really helpful in terms of not having to change too many things when we came in on Monday. So thank you for that, Glenn and the team. You've been wonderful in that space. And I just want to make sure that they have the same support from everybody else. They're probably going to make decisions about things that are going to not seem sensible or practical in the view of trying to cancel non-essential shifts, but I just need you to work with them and give them the information that they need to make those calls if they don't already have it. So I do expect the happy, healthy and engaged workforce that we had last Tuesday at the staff conference to be same values driven communication that we had then to what we have now. And do I have any questions about rostering? I don't want to talk about specific rosters, but anything in general around contact between rostering team or line managers, or anything that you feel that we can address from an organisational level. And I will talk about supports to staff in a moment, but let's do rostering first. So Fiona's asked a question, how do we contact the roster team if we have a problem that needs fixing? So first instance, go through your line manager or the CCC, Fiona, so whatever area that is. Glenn, are we going to send out contact details for the rostering team. We have given them mobile phones now because they're all working from home. But Glenn, what's your best suggestion for how we do that? And Kerry, you can jump in as well as regional manager if you've got another view, but can I get some feedback from either of you on that one?
For the moment, I do think the best first point of contact would be your CCC. While we are currently all working from home, we all have separate phone numbers, and for example, you could contact me today and I'm working on your area, but tomorrow it could be one of the other 4 people in the team that are working on your area. It would be best to go through your CCC to start off with. 9 times out of 10, it is probably an issue that they could resolve on the spot on the phone to you. And if not, then they would forward it through to us and we will come back to you within a business day to get it fixed up.
Cool, thanks Glenn. And the rostering email, the centralised email, what's likely to get a quicker response, a phone call or the rostering email?
If you wanted to send us an email, so just rostering at arafmi.com.au, please don't message that on Teams. It will not be looked at, it will not be responded to, it will not be monitored. So it would just be a straight email through to that email address. We monitor that during business hours. So if it is something urgent, it would still need to go to on-call at that point. And also emails shouldn't be an urgent point of contact anyway, but definitely do flick us an email if it's something that just needs a couple of days to have a look at, and we'll get to you. Usually it's about 24 hours and we'll respond to you, or 1 business day. If it is urgent, please contact one of the CCCs. Once we're back in the office, we'll work towards having a central phone number that you can contact during our hours of operation. But for the moment, while we're not in the office, it's a bit trickier.
It was going to be 1st of July. It's probably going to be a little bit longer than that. But again, and I do want to thank Todd, who's sitting there quietly with a gorgeous little bird behind him. Todd took the Ipswich office as well, so he's been managing calls from there. And I have to say again, thank you to the rostering team. You've really stepped in to help us manage day-to-day operations that might not have been your responsibility before. So the rostering team are going to help with those phone calls coming in and try and field calls as best they can. So thank you for that. Kerry, did you want to add anything to if there's anything that employees need to do if they need rosters fixed, or there's any questions or queries around that?
No, I think Glenn pretty much covered it all. The only thing I'm going to say is if you do need to ring on call, especially during the night, it's probably best to phone and not text, because I don't always wake up to a text message. Yeah,
and I'll add to that. Please do not text on call. Phone is the mode of contact for that. If it's a client emergency, absolutely you should be phoning straight away. If it's 6 o'clock at night, you think, and it's tonight and it's Wednesday night at 6 o'clock, and you go, I'm not going to be able to make my shift on Friday, do not call on call. That's not an emergency. You can flick your CCC and the rostering team an email for that, or you can contact them during business hours. So on call really should be used for if you have a shift at starting at 7 o'clock in the morning and it's Cellar STA, and you know at 10 o'clock at night that you're not going to make it because you're on the bathroom or whatever would stop you from going on shift, then by all means do message for that, because that gives us time to fix it up. But even then I would think, wait, you could give us a couple of hours notice for that instead of doing it in the middle of the night. So just be sensible about the use of on call, but do not text, because sometimes it does not come through and there's no confirmation of information. So you are required to phone on call for any emergency situation. Is everybody okay with that? Can I just get a thumbs up either on the screen or on the thing that you do with the thumbs up thing? Cool, awesome. If anybody's got any questions or queries about that, please let us know, but that's the process to follow. Alex, for you, okay, I know we don't normally do this. I think it is important to recognise the contribution that the carers team make to Arafmi, and that everything's still grounded in carer supports. Could you just give us a very quick overview of how the carers team have responded and what they're doing over the next few days, just so that we're across that too?
Sure, thank you. So this week we haven't got Free here. She'll be back next week, and the team's been really good covering the phones this week from home and doing that. So we've got a bit of a roster happening, and we want to say thank you to Shani for Friday afternoon for filling in the last bit that we've got there as well. We've had to change our support groups to online, so the Intrapilly one tomorrow is online. We had a walking group on Friday, which we've postponed. We're just waiting till Friday to decide for next week what we'll do for the support groups and whether we'll change more of those to online, and our workshops, we can do them all online if we need to as well. But it's been really good, like carers are getting the support that they need. But if you have contact with family and they're not sure what to do, we've got the 24-hour support line that's still there, and that's still happening. And Julie's done a great job coordinating that and making sure it's covered. So that's probably the main bits at the moment. So.
Cool, thanks, Alex. And is Nicole here from Support Coordination? I can't see you on my screen, Nicole, but it might be because I've got so many people there. Is Nicole here?
Yeah, I'm here.
Okay, Nicole, are you okay to just give us a bit of an overview about how Support Coordination have responded, and anything you want to share with the team around anything that might impact them, anything you need from them in terms of communication, please?
So we're all working from home as well at the moment, trying to do everything over the phone. I suppose the hardest thing for us is, the home visits. We're pulling back on them and saying no home visits at the moment. So I guess what that means is if we do have participants supported by Arafmi, and any help from the support workers would be great, because Zoom's good, but half of our participants don't know how to use it. So we need the support workers to be able to help them with things like that.
Cool, thanks, Nicole. And if there's anybody specific around that, please feel free to contact the Triple Cs or Kerry, Kelly or Sharni to help facilitate that. Just in the best interest of communication, go through them rather than the individual support workers, but we'll be more than happy to set that up. If we do need to, if clients don't have the capacity to do that, and we do have some tablets in the office that we can probably borrow from the carers team to allow us to take some tablets out to clients to do that if need be. So if there are any issues with clients not being able to connect because of technology, let me know, and we'll see what we can do to support that.
Thank you.
Cool, thanks, team. Okay, Glenn wants to add another couple of things, just the team, and then I'm going to open it up to questions. And actually, I might go back to before, when Glenn finishes, I'll double check with Kerry and Karen and Kath from People and Culture to see if there's anything else you need to share, and then we'll open up to questions. So I'll hand it over to you, Glenn.
Thanks, Irene. I just wanted to start off. I just wanted to thank everybody for their help so far. We have had a massive amount of work over the last couple of days trying to reorganize shifts. So people that have had shift cancelled, times moved, that type of stuff. Like, I really do thank you for being so accommodating. One thing I did just wanted to try and mention that if you aren't able to work a shift, could you try and give us as much notice as possible? And I don't mean calling on call in the middle of the night, but maybe a bit more notice than 20 minutes before the commencement of the shift would be great. It's we're working towards trying to make sure that every shift is replaced. So if you're not able to make it to your shift today, we want to try and make sure that someone else gets out to the client for the day. And that 20 minutes does not always allow us enough time to find a suitable replacement to go out to the client. I understand things come up in everybody's personal lives that mean that, you know, they're not able to make it 2 shifts, but just try and think things through. And I know it's hard to sometimes try and prioritize, but you know, just picture the impact on your client when you are cancelling 20 minutes prior to arrival time. Other than that, we do have lots of more shifts coming up, lots of more changes happening within the roster. So don't be concerned if you're seeing things happen. You can always reach out for clarification or understanding about what's happening. That's not a problem at all. And if you are looking for extra work, just shoot us an email, let us know what your availability is. That's fine. We are trying to make sure that we're working towards managing your own fatigue levels. So we don't want to work you 14 days in a row. Obviously, we don't want to be running too much overtime, but that's not the main concern. It is the concern of you having your days off, you having your rest periods, you having your time with your families. And when I've been reviewing the rosters, there's a lot of people that have been working for a long time without a day off. So while you might see some changes to your roster, we're not trying to short you out on hours at all. We're just trying to make sure that we're working you safely and legally and appropriately for the clients.
And can I just add something to that? We've been doing a fair bit of review of the award, and we're making sure that we're that our rostering practices are in line with the award. So we will put out some information to all staff in the not too distant future, just in terms of where some, just to make sure that everybody's singing from the same hymn sheet in terms of how we're interpreting things and how we're doing things. So we just want to make sure everyone has the same information.
Cool, thanks, Karen. And just to reiterate that, and I'm fully supportive of that. And in fact, it might be an unpopular decision, but I was behind the directive around not working any more than 3 sleepovers in a row. And I appreciate that some people that's been challenging, but having been a support worker myself, too long ago for me to remember, but recognising the fatigue levels when you go on night shift or sleepovers as well. Partly it absolutely is about your health and well-being and your longevity in the role, but it is also about your capacity to provide effective services. And I think when people are fatigued, we are working with people who are vulnerable and need us to be fully on when we're on shift. And I don't believe that it's appropriate when people are fatigued to be providing supports to people who are vulnerable. So we want to make sure we're providing a really good quality service and that we've got the right environment for you to be fit and healthy and well in that. And I get sometimes there might be decisions that are a little bit uncomfortable for people, but they are done with the best of intent. And part of the reason for these Q&As is to be fully transparent about the decisions we make and give explanations about why we do it, what's the rationale behind it. So even if you're still a little bit frustrated with it, you can understand why we do things in a particular way. But it was my directive around no more than 3 sleepovers in a row. I am happy to offline hear feedback about that, and I'm always happy to talk about shifting things if I've got that wrong. But that's some of the decisions that we have to make on things. Okay, Karen, do you or Kath, in terms of people and culture, want to talk about anything that employees might need to know over the next couple of days or weeks?
No, I did want to give a little bit of a plug for FISH and just say this is a great opportunity to be practicing, making people's day, taking the time to play a little bit if we can, being there and being present for not just for our clients, but for each other and our family, because it is a pretty challenging time. And I guess the biggest thing is just making sure we're all choosing our attitude. It's pretty tough being in lockdown, but we can make the best of it. It's everyone's in the same boat, so let's do what we can just to make it entertaining for each other. Cool,
thanks, Karen. Kath, did you want to add anything before I move over to Kerry and then open it out?
Yeah, just on the tail end of that, if you are struggling at the moment or finding the lockdown stressful, please reach out to the Employee Assistance Program that we have. We've got an organisation called Amavita who provides free and confidential counselling services. So please, if you are struggling, please reach out to that service. Thank you.
Cool, thanks, Kath. That was delivered so well. It was almost like a soundbite for a TV advert. So I think we should get you on the screen for next ones of those. Thank you.
And can I just say thank you to Dan for having the fish sail across the screen for. There we go.
Very good, Dan. Cool. No, thank you for that. And again, in the spirit of transparency, I have used EAP for myself, and I would wholeheartedly recommend it. Even as a proactive measure, if you're not feeling the stress at the moment, the pandemic has, there's been significant impact on people's mental health. Please use it proactively if you feel that you need to too. So it's a nice way of just trying to keep you healthy and well, rather than wait till there's issues happening. Okay, Kerry, just from the representative of NDIS services at the moment, and I know we've not really discussed it, so I'm kind of chucking you in it. Is there anything else you want to add to staff, or anything that you want to discuss before we open it out to questions and answers?
No, I think it's just important to remember the impact that we're having from our decisions on the clients. If we're going to cancel a shift late and stuff like that, just it's always really important to remember the impact. I'm going to say my phone has been running hot for the last couple of days. If I don't answer your phone call straight away, I am working on getting back to everybody. I'm sorry, it's just not the best time. I have only got one phone, so doing my best. And I just want to thank you all for doing a wonderful job. I know everyone's putting in a great effort, so thank you, appreciate it.
Cool, thanks, Kerry. And if your phone is running off the hook, can I just encourage people, and I'm sure you're already doing it, but it's just to reiterate, use the CCCs first, then your client care leaders, then the regional manager. So obviously if they're busy, again, they might be on the phone or they might be dealing with stuff. You might not get an immediate response, but if you require an immediate response, that's where you might flag that up to Kerry. If you can't get Kerry, please use People and Culture. Please use Glenn if you need to. Please use me if you need to. But let's try and use the process of CCCs, CCL, regional manager, that kind of level. If in doubt, I'm comfortable for you to spam everybody, but only do that if you say this email is directed at this person, and be really clear about what you want from the outcome. Just because normally if you put a bunch of people in an email, nobody knows who's responsible for it. So if you really, really can't get hold of somebody, you're welcome to flag it to multiple people, but be really, really clear in your communication about what you need from that particular email.
Yeah.
Okay, so what we'll do is we'll open it up now. We've got about 13 minutes left. That's not too bad. We're doing okay for time. I'm going to open it up. Does anybody have any questions, comments, suggestions to your colleagues about how to work through this particular lockdown? You're welcome. I think probably the best way to do this when we open it up is shove it in the chat first, and I'll facilitate that, and then we'll open it up to open mics just at the end. So does anybody have anything that they want to raise? You're going to be a quiet bunch tonight. Okay, if nobody's got anything, that's fantastic. If there are, we have had a question around replacing shifts or financial support. So we've got somebody, the question is, I got sick 4 weeks ago and still have your cough. If you are showing symptoms of being unwell, you must not attend work while you're unwell. So even if you're doing that, I'd need to, so anybody who's unwell, I'd want a fit for work certificate. If you're showing any signs of cough, etc., let's have a look at that. The person who's contacted me around that one, will take that one offline, and we'll talk to People and Culture around it. If you've still got some symptoms, we'd want something just to make sure that you're safe for work and not contagious. So thanks for bringing that up. So the person that's raised that, can you touch base with your, probably Kerry actually in the moment, even regardless of what area you're in, and we'll work with you on that one to make sure you're not out of work for as least time as possible. So we had an offline question from somebody around not being in work because they were being cautious because they were a friend of somebody who was in a close contact site. Now, I contacted Queensland Health hotline because I am deemed as a close contact because I was at the Woolworths in Tenerife at the time that there was a live case there. What they have reassured is that close contacts of close contacts do not need to self-isolate, they just need to monitor for symptoms. So they were very clear on that. I explained my personal circumstances. I live with someone and said, here are all of the things that I've done, here's my work situation. And they said close contacts of close contacts are not required to go and get tested or self-isolate at the moment, but just to monitor for symptoms. So there's obviously some nuances if you're choosing to to be safe and sensible. If you need to take some time away from work, talk to us about working up those hours at another time. As Glenn said, there's more than enough hours to go around. We do have plenty of shifts, and we'll try and make sure that you're not losing any income by giving you the hours that you need. And anybody who's required to be in lockdown, if they can contact your line manager, contact Kerry or myself directly. If anybody is required to isolate under Queensland Health restrictions, and if you are required to isolate, you will get an email and communication from Queensland Health requiring that. Please let us know, and we'll work through that process with you. I've got another couple of questions here, but I do want to acknowledge John's pug on his lap. This is very important. Very nice, John. Mine's a little bit older than that, but lovely to see that there's another pug owner there. So Christy's sent an email. Oh, Christy, you're in Darwin, bless. All right, we'll talk to you offline about how we help get you back safe and sound, and make sure that you're feeling connected and supported. Sorry about that, that sucks for you. But let's see what we can do when you're back. But if you can take that one offline and talk to, I think Kerry would be your line manager as well, and we'll work out what to do with you, Kerry. Got a question from Terry. Are we required to get vaccinated? No, you're not legally. Would we like you to get vaccinated? Yes, please. But we cannot force you to do that, and I won't be making any political comments on vaccinations, etc. I've had my first one of Pfizer, and I heard from government today that we might run out, but I'm waiting on the second one. We are fully supportive of you going to get vaccinated, and we will allow you time off to manage that. I know that there has been a national mandate for aged care workers to get vaccinated, and the conditions around that are first vaccination, so the first jab by the end of September, I think it is. So if the government do choose to mandate disability workers or mental health workers, you'll still have a 3-month period to get your first jab. Back end of Arafmi, we're prepared for that in terms of if it comes to legislating, it'll be similar to blue and yellow cards and NDIS workers orientation, but we'll manage that when it arises, if it arises. But just to confirm, no, you're not required to get vaccinated at the moment. We've got a question. If a client has a previous medical exemption to not wear a mask, is that still valid, and how you would like us to manage that? Just contact your line manager, and if it was previous, we'll assume that it's current, and we'll make a risk assessment on whether or not we can safely provide services to that client. And what I'd say in the past, we've made some pretty sensible decisions around that. We're not going to get too complicated about it or withdraw services unnecessarily. So we'll make that work sensibly if we can. If somebody, so I do have a question about viruses in terms of the vaccination. I'm not going to talk about that one, Fiona, in terms of personal circumstances. I think that's a unique situation to everybody, and we'll deal with that on a case-by-case basis. But at the moment, just to reassure you, whilst we're supportive and encouraging of you getting vaccinated, Arafmi and the mental health and disability sector are not requiring that from workers at the moment.
Can I just say something, Irene? I've just been checking out Centrelink, and there is pandemic leave disaster payment. So I'll do a little bit of research and I'll get some information out to people. It's to cover people who have required to self-isolate for up to 14 days. So it's a payment made by the government.
Yeah, cool. All right, thank you. And Nick, I'm not sure if you're joking or not around this comment. You'd like to send a company-wide invite to your tea party on Saturday night, bring your own bottle. That's cool if you do, but I'm assuming that's going to be online. And if anybody breaks regulations, I'll be making sure that they do not come into work while they get quarantined and tested, and we won't be paying any of your fines. So Nick's invitation is not a work situation, and I'm assuming you're making a joke, but you're welcome if you want access to Arafmi's Zoom to set up your company-wide tea party online. We'll happily support that. I'll even facilitate it for you. I'm not going anywhere on Saturday night, so I'm happy to be host. But yeah, absolutely. I'm assuming you're all joking. Cool. Okay. All right. Any other questions or comments before we end for tonight's session? Can I just get?
I have one.
Oh, yeah. Sorry, Kaz. Yeah.
I'm sorry. I have to take a few days off because I actually have a heart problem to have my jab. So would that affect anything, like my client wise or anything?
I don't know, but without knowing the full detail of that circumstance, I wouldn't be able to make a recommendation. But if we can take that one offline and talk to Kelly, Kerry, or People in Culture, and we'll do what we need to do to make sure that's a safe process.
All right, thank you.
Cool, thanks, Cassie. Any other questions or comments? All right, can I just do a bit of a thumbs up? And I know that I'm probably preaching to the converted because you've all attended, but are these Q&As helpful for you in terms of getting the information? Do you want us to keep going with these? My sense is yes, you probably do, but are they helpful? And cool, okay, so I'm getting bit there. I'm just going to check. So if they're, for the people who either don't think they're helpful or are a bit ambivalent around it, could you let me know either what we can do differently to help communicate, or is there something you just want us to stop doing? The intent of these is we know that we send out emails to people, we send out newsletters, but people are only engaged as they're engaged to read it. The intent of setting out the Q&As was to give people a space to ask questions to the exec, for us to be upfront and honest about what we can do to explain decision making, all of those things. But if there's another way of being more engaged, or you want something different, do please let me know, and we'll see what we can do. But thank you for all of your feedback on that. I think we'll probably set up another one for 2 weeks' time, unless there's some other circumstances. If we do go into another lockdown next week, we'll set up another one for next week just to touch base with you around how you're feeling, and we might do something a little bit different from the from just having me talk and then ask questions. And actually, Ethan, we've got a really good question. We are still on track for full-time positions in July, Ethan, but it will be pushed out till the end of July. This week's just we've just not had the chance to do anything with that. So again, I appreciate your patience with that. It's not a massive amount we can do about it at the moment. But Karen, you've got the date of, can you confirm the date that we've talked about for that?
Yeah, so we're planning to roll it out region by region so we can make sure we do it effectively. And at this stage, we're looking to go live, starting with Moreton Bay region for the last pay period in July, which I think is the 28th or the 25th or something like that. So Glenn and I have been talking about that today, and we hope to get that in place. And then we'll have the one-on-one conversations with the people who've put their hand up, and then we'll go from there.
Cool. Okay, thank you for that. And again, thank you everybody for your patience. I know it's not ideal. It's not our preferred way of doing things, but we've had multiple things that have impacted us to have this blown out a bit, but we are working on it. And as I said, there's been multiple people working more hours, and I've had a couple of weekends with Karen being in the office trying to get things done on a Saturday. So we're doing our very level best with some limited resources to get that to you as quickly as can. But thank you for your patience and your understanding. Okay.